Welcome, everyone. Thank you for joining us at our first Maternal Child Health live stream virtual event. My name is Lisa Lathrop. I'm the Program Manager of the Nurse Family Partnership Program at Family First Health. Maternal child health not only affects our mothers and children, it also affects our community as a whole. When we support mothers and their children, we're having a positive influence on future generations in our community. It's an honor to have the opportunity to support a healthy present and future for everyone. Today, we are celebrating Maternal Child Health Month by speaking about factors that affect the health of this population, as well as the programs right here in our area that target these factors. We will also be providing giveaways throughout our presentation, so stick around until the end for your chance to win. To win, you have to be logged onto Facebook or YouTube so that you can comment and get a chance to win. You can only win once, so participate and have fun. It's with great pleasure that I introduce you to the Mayor of York City, Michael Helfrich.
Thank you, Lisa, and good afternoon, everyone. I bring a proclamation and greetings from the mayor's office, but before I read the proclamation, I just wanted to thank everybody. I was just talking with the governor this morning about what more we need to do to address the issues that we have, all of society's issues, where the trauma and the inclinations for individuals come from how they are treated and how they feel about themselves at the very earliest stages of life. And in these very difficult times, the folks on this call, in this meeting, have really extended themselves, and I'm very grateful. I know that you are under-resourced and understaffed, but you are still out there trying to help every single mom and every single child that you can. And I want you to know that it does not go unrecognized from my office, and people throughout the community are very, very grateful and thankful for the work that you do. With that, I bring you a proclamation for Maternal Child Health Awareness Month. Whereas according to the American Public Health Association, maternal and child health is an important public health issue, and investments in prevention, healthcare, and education last a lifetime. And whereas promoting, protecting, advocating, and advancing information and education to ensure the health and wellness of women and children is a priority. And whereas the well-being of women, infants, children, and families is a goal of Healthy People 2030, and their well-being directly impacts the health of the next generation. And whereas the risk of pregnancy-related complications and infant and maternal mortality can be decreased by accessibility of equitable, high-quality care. And whereas racial, ethnic, and economic disparities continue to exist in both infant and maternal morbidity and mortality. And whereas maternal and child health is influenced by a complexity of factors, including but not limited to social determinants of health, access to equitable, culturally relevant, and competent care, mental health of parents and caregivers, family income, pre-existing health, educational attainment, substance use, adequate and appropriate nutrition, safe and healthy families and neighborhoods, exposure to adverse childhood experiences, social supports, and available resources. And whereas the York County Maternal Child Health Community Advisory Board and its members, partner agencies and organizations, healthcare providers, counselors, home visitors, families, public health staff, and city government recognize the need for and actively pursue strategies to empower women, infants, children, and families to reach their full health potential. And whereas on this month of April 2022, the City of York joins the York County Maternal Child Health Community Advisory Board in increasing awareness of maternal child health and advocating for the health and well-being of all. Now, therefore, I, Michael R. Helfrich, Mayor of the City of York and the Commonwealth of Pennsylvania, do hereby proclaim April 2022 as Maternal Child Health Awareness Month in the City of York. Thank you again, everyone, for partnering, working together for the betterment of our entire community.
Thank you. All giveaway must be picked up at Family First Health at George Street at the third floor receptionist Monday to Friday between 9 a.m. and 3 p.m. Our first giveaway is a Costco high back 2-in-1 booster car seat, and it can take babies that weighs between 20 and 80 pounds. And in that basket, you will get Lamps and Ivy plush elephant, sequin orange fox plushie, a Coed travel first aid kit, and the first person to comment maternal child health wins. So I will be watching the comments. If you comment hashtag maternal child health. Okay, so for the first winner, we have Lauren Gladhill. You are the winner for our first giveaway. And now our next speaker is Mary with Nurse Family Partnership. Thank you.
Okay, let me address my screen because we moved some things. Sorry, can you see my head? All right. Well, hi. My name's Mary. I am a nurse with Nurse Family Partnership. I've been in maternal child health for almost 40 years and with Nurse Family Partnership for the last 9. With NFP, first-time moms get their own nurse. And over the next 2.5 years, you not only get connected to a lot of the resources you're going to hear about today, to be sure you and your family get the best care possible, but with NFP, our end goal is self-efficacy, that you can take what you learn, use it everyday life to be the healthiest family you can be, whatever that family looks like. It starts with building trust. First, we get to know each other, and then we kind of address whatever it is that you need, because each mom needs something different. We can connect you to food resources, breastfeeding resources, childbirth classes, car seat resources, parenting classes. If you need it, we can probably connect you to a resource. And something simple as making an appointment to get healthcare really isn't so simple for a lot of people. Some don't even know where to go for healthcare, so we help them find what they need. Text is a norm for many, so making a phone call is something really new to a stranger. So we role play. We've done 3-way calls with your office to make you feel supported and not alone. And sometimes we can even go to the doctor's office with you and help support you in the decisions that you've made for you and your family. And before you know it, you're making all of your appointments and your child's appointments, and you're really feeling good. And speaking of feeling good, good health includes many things. Good food, how and where to get it, good recipes. You're going to see a recipe, I think, right after me. And sometimes we teach you how to cook simple meals, healthy snacks, fun things to do as a family. In our monthly newsletter, we always have a craft for the family, and we help you build a support system so by the time you graduate, you're good. So we empower you in NFP to know how and where to get what you need as a family to be a healthy family. So we plant the seed and we help it grow. So anybody can be referred. As long as it's your first time baby, we can figure it out. So enjoy the rest of your day.
Okay, thank you. Our second giveaway is a gift card bundle, and I will let you know what's in there. We have a Target gift card, a wireless charger and speaker, an NFP travel blanket, and a water bottle. And for this, in order to win, we will take the second person to comment Nurse Family Partnership. Remember, the second person. Second person to comment Nurse Family Partnership. Okay, let me read. And the second person, I'm sorry, I have to go back because so many people commenting now. So the second person to comment Nurse Family Partnership, we have Mary Bustamante. Congratulations, Mary.
Hi, everyone. I am so excited to be a part of this presentation today. And I thank you so much for joining us for all of this wonderful information. My name is Terry Rensel. I'm with Penn State Extension's Nutrition Links program. The Nutrition Links program offers free nutrition education classes to participants who are eligible for some sort of food assistance like SNAP, WIC, food pantries. And the goal of our program is to help participants develop knowledge and skills that might be helpful in achieving a healthier diet for the family on a limited budget using resources that are available to them. We partner with many community agencies throughout York City and York County, including those who are participating here today. We do our classes in partnership with them in person, on Zoom, or a combination of both. We use several research-based curricula to tailor each class to the audience we're reaching. We have a curriculum called Eating for a Better Start, which is designed for expectant and new parents, and the topics include eating to support a healthy pregnancy, infant feeding, including breastfeeding and bottle feeding. And today I'm going to tell you a little bit about one of the lessons from our Eat Smart during pregnancy, and I'm going to do a quick recipe demonstration. So cross your fingers and hope that I get the technology all right. I'm going to share my screen. And hopefully pull up my slides. So when you're expecting, a lot of things are changing. The things that we talk about in our classes help you feel good during your pregnancy, improve health for you and your baby, help to manage and attain a healthy weight, help to prevent foodborne illness. It's definitely a time of a lot of changes. Our bodies, our relationships, our circumstances, even our finances change. So when you're achieving better nutrition, you're just going to be able to handle things better. A healthy pregnancy must be supported by a healthy weight gain. So we'll talk about what that looks like for you. And I love this slide because this really shows that it is important to have a healthy weight gain, usually between 25 and 35 pounds, which requires an extra 300 calories. And we'll talk about what those extra 300 calories should look like. We have some tips that we talk about. We really encourage variety and balance. Eating 3 meals a day, maybe 2 small snacks, or maybe just small meals throughout the day will work better for you. We don't want expectant moms, especially, or new moms, to go without eating for more than a few hours at a time. We want you to get lots of fruits, vegetables, and whole grains. So we'll talk about where to get those in your diet, how to get them with the resources you have available. This is one of our favorite messages to convey. Make sure people know that fresh, frozen, and canned all count. If you have canned fruits and vegetables in your cupboards, you have nutrition in your cupboards. We refer a lot to the Choose My Plate website. There's lots of information on here about eating throughout the life cycle, and there's a wonderful recipe database that we draw from. When we say we don't want folks skipping meals, we want to really encourage you to learn what you can do to plan and make sure that you are eating throughout the day. We encourage 6 to 8 glasses of fluid each day, and we want a lot of focus on foodborne illness. We want to make sure that during your pregnancy and for the sake of the baby, we want to make sure you're avoiding foodborne illness by separating on cleaning, by concentrating on cleaning, separating, cooking, and chilling. Some foods to avoid during pregnancy. Hopefully you've heard this. Uncooked deli meats or hot dogs, soft cheeses are one, some herbal supplements and teas should be avoiding. This is one of the Nutrition Links recipes that I'm going to demo today, but I'm going to combine it. I'm going to tweak it with a recipe from the My Plate, and we're going to make this in a mug in the microwave. Some of the important nutrients you should be getting more of when you're pregnant: calcium, protein, iron, folic acid. You can see that 3 out of 4 of those nutrients spinach was listed in there, and the zesty spinach omelet I'm going to focus on will provide those nutrients. This is the recipe that I'm going to be using. I'm going to half the recipe, so I'm going to be using 1 egg, a tablespoon of milk, because that's what the omelet in a mug calls for. I'm going to use some seasonings, a dash of cumin, a dash of salt, a dash of pepper. I'm going to spray my mug with non-stick cooking spray. I'm going to use a half a cup of raw spinach. You could use frozen spinach. I'm not going to cook mine. I find that it works quite well if I use it raw, but you could also use frozen spinach. That's one of my favorite ingredients to have on hand in the freezer. I'm going to use about 2 tablespoons of reduced fat cheddar cheese. And then when the omelet is done in the microwave, I'm going to top it with 1/4 cup of salsa. I'm going to swap out here and show you all the recipe that we're going to sort of combine with this one. It's for a recipe for an omelet in a mug. So you can do this in the microwave. It's literally going to take about 3 minutes. So I'm going to stop sharing. And I'm going to change my camera view so that you can see my stovetop. And I'm going to, okay. So I got my mug, just a regular old microwave safe mug. I'm going to spray that with some cooking spray. I'm going to crack an egg into the, now, for the sake of demonstration and time, I did not wash my hands, but I would have done that, and I would do it again right now to get rid of any potential cross-contamination from the egg that I used. I'm going to scramble that up. I'm going to add my seasonings, little cumin, little salt, little black pepper. Going to add my cheddar cheese, low fat, and I'm going to add my pre-chopped fresh spinach. I'm going to get that in there. My milk. Going to give that a good mix. Going to make sure that my egg-covered fork is out of the way so I don't get any egg on anything. And I'm going to pop that in my microwave for about 30 minutes. While that is cooking, I'm going to change my screen. And I wanted to tell you, we talked about having access to healthy recipes. That's one of the things that you'll get with Nutrition Links if you take our series of 5 or 6 week classes. We give you gifts to help to have you use what's been learned, and some of those gifts will be in the next giveaway. So let me go back to my other setting again. I'm going to show you where we're at with the omelet. Well, that didn't work. That is it. So I'm pulling this out of the microwave. I'm going to use a clean fork. If you can see that the egg is starting to get a little bit hard, and I'm going to put that other fork out of the way so I don't cross-contaminate anything. I'm going to pop this back in the microwave for about a minute. I'm going to be watching in my microwave to make sure when I see that start to puff up over the side of my mug, I'm going to stop the microwave and pull that out. You can always, if you undercook it, you can always pop it back in your microwave. But we're probably at about 3 minutes now for this recipe, and we are about 20 seconds to completion. So this is a great sort of quick fix and go kind of recipe, providing loads of nutrition that are important to support a healthy pregnancy. Got 15 seconds left. The information for nutrition links will be shared at the end of our presentation, and I hope that I will see some of you at some nutrition links classes. You can also get the information from any of the participating agencies today. I'm going to change my screen view again, and I'm going to show you the finished product. This is one of my favorite recipes, techniques. So you can see it's cooked in there, and I've got this cute little egg cup. With the cheese, the calcium, all those nutrients in that spinach, and the protein in the egg for a really well-balanced, quick and easy breakfast, lunch, dinner, or snack. It's going to change back my view and say thank you so much for having me today. And I'm excited for Nutrition Links to be giving away some goodies next. So I will look forward to, maybe meeting some of you at a Nutrition Links class. Thank you so much.
All right. Our third giveaway today is from Nutrition Links, as Terry already stated. We have a bottle rack, a Thrive mascara, Wellspun reusable bag, a portion divided plate, fresh food brush and peeler tool, a storage thermometer, hot pad, jar opener, small strainer, adjustable measuring spoon, water bottle, board book, toothbrushes and toothpaste, healthy eating on a budget recipe cards, and some healthy homemade 2022 nutrition and fitness calendar. And now for the winner, we will take the first person to comment food safety. First person to comment food safety wins. Okay, so the first person comment food safety was food safety. Food safety. Okay, we have, I don't know if I will pronounce it right, but it's Irena Vresk, Iorena, last name Vresk. Thank you, Irena. You can stop at our third floor in George Street to pick up your prize.
Hi, everybody. My name is Charlotte Dorsey. I am the WIC Education Manager at our Community Progress Council WIC Clinic, and I am joined by Hazel. I'll let her introduce herself.
Hi, my name is Hazel Fuentes, and I'm the breastfeeding nutritionist here at CPC WIC.
I am a certified lactation counselor. Hazel is on her way to be a CLC as well. So we are our breastfeeding professionals in our York location. And we wanted to talk to you a little bit about breastfeeding today. So about the WIC program itself, WIC is an acronym for Women, Infants, and Children. We are a supplemental program that focuses on providing nutrition education and breastfeeding support to our low-income families in our county. Those families can include pregnant women, breastfeeding women, postpartum women, infants, and children up to age 5. Breastfeeding is a really large part of our program. All of our nutrition team members, our other nutritionists beside me and Hazel, are all trained to provide breastfeeding promotion, support, and education to all of our WIC families that walk through our door. Our goal is to reach mothers before they actually deliver because we want to discuss different breastfeeding barriers or things that may be stopping them from breastfeeding and basically problem solve with them. How do we get a barrier out of their way to help support them with their breastfeeding journey? We encourage breastfeeding and supporting any mother's decision to breastfeed, whether that be exclusively breastfeeding or partial breastfeeding. So breastfeeding appointments usually include that basic breastfeeding education, problem solving with any breastfeeding issues that you may have, as well as setting up a goal to meet you and your baby's needs. So we wanted to talk about the different benefits of breastfeeding. We hear a lot about the infant's benefits, but not so much the mom's benefits for her choosing to breastfeed. So for mothers, if you do choose to breastfeed, we encourage it has been proven that it reduces the risk of breast and ovarian cancer. If you choose to breastfeed, it also can reduce your risk of developing osteoporosis. Osteoporosis is basically a thinning or weakening of the bones, which we as women are more inclined to develop compared to males. So this is something that can help you reduce that risk of developing it. It also reduced the risk of developing anemia. We know through delivery, whether that be C-section or vaginal, there will be some blood loss, and that also with breastfeeding that helps reduce that as well as help you heal, and then can also help with any of the symptoms that are associated with anemia. So tiredness, headaches, weakness. By breastfeeding, you're also reducing your risk of obesity for yourself. We know that breastfeeding can actually help you lose weight after delivery. It helps aid the contraction and shrinking of your uterus, which is also associated with that the development of anemia and reducing that risk as well. So there's a lot of really great things that you can do for yourself by choosing to breastfeed, but then there's also amazing things that you can do for your baby to breastfeed as well. So with kiddos who are breastfed, they tend to be less fussy. They experience less issues with constipation. There's usually less vomiting and spit up, as well as less issues with colic symptoms. But similar to the moms, infants also have similar reducing risks of certain cancers, developing diabetes. They also reduce their risk of developing obesity at an older age. There's reduction of allergies, reducing the risk of developing asthma. Our kiddos who are breastfed tend to have higher IQs as well. And then also too, they also are less likely to experience SIDS, which is another acronym for sudden infant death syndrome. So there's a bunch of different benefits for moms and babies if you do choose to breastfeed. But there's also things specific to breast milk that causes all of these wonderful effects. And I'm going to pass it off to Hazel, and she will go over what makes breast milk so beneficial.
All right. So just to echo what my colleague Charlotte shared, breastfeeding promotion and support is a core component of the nutrition services offered here at WIC. Research shows that breastfeeding is the best source of nutrition for infants, and it provides many health benefits, as Charlotte already mentioned, economic and emotional benefits for both the mother and the infant. So here at WIC, when a mother applies to participate in the WIC program, one of the many questions we ask is, so tell me, what do you know about the benefits of breastfeeding? And I can tell you that more than half of mothers, parents, they tell us that they know nothing or very little. And, we tell them that's okay. Would you allow me to share some more information with you? We know that studies show that mothers who are more knowledgeable about the numerous health benefits of breastfeeding are more likely to breastfeed. So once a mom is willing to learn, we promote breastfeeding by first showing them the benefits of breast milk. And we have several resources. One of the first pamphlets we usually give out in the first appointment talks about the comparison between human milk and formula. And it clearly shows how breast milk is a complete nutrition. I mean, the list is long. It provides all the necessary nutrients for good growth and development, both for the brain, the immune system. And formula companies may claim that formula is the closest, that they might have the closest thing to breast milk, but we know that human milk is far superior and it can't be duplicated. So, for example, we know that formula can now offer antibodies. And not only that, breast milk has hormones, antiviruses. I like to compare breast milk to baby's first vaccine. And of course, we know that not all babies are able to breastfeed. Sometimes formula is needed for medical reasons, but we're here to support, like Charlotte said, support mom's decision on how they decide to feed their babies. And really, our goal here at WIC is try to empower families, individuals to make informed choices, supported by the best available evidence. We try to be honest with families, with mothers. Breastfeeding may be natural, but it also is a skill that takes practice. Breastfeeding requires learning, and breastfeeding for some can be challenging, but it can become easy with the right support. So where to start? We encourage mothers, we encourage parents to start having that conversation with your healthcare provider, with your nurses, with your doctors. Join a support group, ask questions about breastfeeding. If you're concerned about your medical condition or any medications that you take, ask questions. And second, start that conversation with your family. We know that families play an important role when it comes to breastfeeding in helping you make that decision, and also after the baby is born, that support at home. So here at WIC, we encourage you to bring grandma. We encourage you to bring your husband, your partner, anyone close to you that you think will be important in this journey. We want the whole family to be on board. If you're a working mother, it's important to have that conversation with your employer. Know your rights about pumping and breastfeeding if you're planning to go to work. And then third, understand the basics. Get comfortable with the idea of breastfeeding. Here, like Charlotte mentioned, right from your first appointment, we try to talk a little bit about breastfeeding. We know that mothers who determine to breastfeed sooner are more likely to breastfeed for longer periods of time and are less likely to introduce formula. So, it's important to become familiar. What does a good latch look like? What are different breastfeeding positions that I can use? How can I tell that my baby's getting enough breast milk? All of those are important questions to think about before baby arrives. And finally, reach out for help. Don't be shy. Don't hesitate to ask for help if you're having issues, if you have questions in the hospital after coming home. We love it when parents come to our office and ask us questions. Bring your questions, bring your concerns. We'll do our best to address them. And I believe there's something that they'll bring up on the screen that has our information. Charlotte's number is there. If you are a WIC participant and are currently breastfeeding and need support, please don't hesitate to reach out to us. Charlotte's extension is 113. If you want to refer someone to us that you think they might benefit from our program, you can pass this information on. I can also provide breastfeeding support in Spanish. And we are located on 130 West Market Street. We also have different clinics, outer clinics like Shrewsbury, Delta, Dillsburg, the list goes on. And we just want to thank you for letting us share a little bit of what we do here at Community Progress Council WIC in York County. Thank you.
Thank you.
Okay, thank you. Our fourth giveaway is a wig bag. And in our wig bag, I will let you know what we have in there. In our wig bag, we have a bottle rock, a Thrive mascara, a Wellspin reusable bag, travel food container, a travel utensil and peeler, travel snack box, 3 board books, breastfeeding bracelets, healthy moms, healthy babies onesies, toothbrushes, toothpaste, and pens. And now for a fourth giveaway, the second person to comment, hold on. Since everyone's already commenting that, I'm sorry, but we have to choose something else. The first person to comment Wick breastfeeding is going to be the winner. The first person. Wick breastfeeding. Remember, as one comment, Wick breastfeeding. Okay, so we have a winner. Actually, the winner is, let me go back to see the first person that commenting that so I can be fair. It is Kara Gonzalez, Karonzales. Kara Gonzalez. You are the winner for our week basket. You can stop at our third floor on George Street and you will get your prize. Thank you. And now we're going to have a fourth giveaway as well before we pass on to the next speaker. I'm sorry, I said fourth, the fifth one. It's a booster seat. And now we have a Harmony Pink Zebra booster car seat, 2 board books, and a 6-inch sequin gray raccoon plushie. And for this one, the first, or we did the first, I'm sorry. The second person to comment maternal child health. Maternal child health. The second person to comment that will win. Okay, so the second person, let me go back and look again. Maternal child health, second person. Okay, the second person we have is from YouTube, and it is Maria Tataglia. Maria, Maria, and the last name Taortaglia. Thank you, Maria, and you can stop at our George Street office, third floor, to pick up your prize. And now we are going to have our next speaker, and it's Roxana from the Centering Program. Thank you.
Hello, everyone. My name is Roxana Grimes. I'm the coordinator for the Center in Pregnancy program run at WellSpan Health by York Hospital's OBGYN office. Today, I would like to speak to you about how providing cultural competent care affect the maternal child care and how we at Center in Pregnancy follow a model to achieve and deliver such type of care. So, health professionals and organizations who practice cultural competent care are able to deliver an array of health services to patients by addressing the cultural, linguistic, and social needs of their patients. On the other hand, healthcare professionals and other providers who lack the cultural competent care can drastically affect the outcome of maternal child health. Some of the major factors that can contribute to maternal patient dissatisfaction within the healthcare system are being misunderstood, potential language barriers, lack of trust within the healthcare system, perceiving that they are not welcome, financial barriers, or are geographic barriers. By providing appropriate cultural competent care to the maternal child care health system, families can make well-educated and collaborative decisions alongside their health professionals. This is the foundation of encompassing patient professional care. Once the rapport is built, families will not only entrust their medical professionals with the longevity of their own personal health care needs, but also they will entrust the care of their children. This is imperative that our healthcare organizations are able to provide appropriate training to all members of their health team so that families are able to feel understood, break through the language barriers, build rapport, feel welcome, and trusted to openly discuss other barriers such as transportation, finances, and resources within the community. The reality is that maternal care professionals work with patients who come from an array of different cultural backgrounds and different walks of life. It is important for us, the medical professionals, to understand client values and beliefs by having a clear understanding of how the family dynamics work, religious beliefs, and even on how certain medical practices will influence the patient care. For example, in some cultures, some expectant moms rely on their partners for the medical advice or input before making any medical decision. Some may believe that having a hysterectomy minimizes their feminine aspect in the family makeup, or have the thought of the doctor knows best, regardless of their own maternal instinct, and just do as the provider recommends rather than ask questions or voice their concerns. In addition, some cultural diverse patients may have specific requests, such as gender of their practitioner, whether they are for or against circumcisions, or even blood transfusions during emergency situations. So, to continue to provide the best quality care of maternal patients and their offspring, it is again imperative to ensure clients have a voice and we give them a voice and a strong professional bond with their healthcare providers by competently addressing and respecting patients' cultural and valued needs. The patients and the baby will have the right tools to have a healthy and stress-free pregnancy. Now, in the central pregnancy model we follow right here at our practice, York Hospital OBGYN Edgar Street, we're geared towards recognizing, being aware, addressing, and overcoming those existing cultural barriers by providing both the providers and the patients the right tools to overcome those barriers. This is a pilot program that we started on May 19th, 2021. During this initial stage, this program is geared exclusively down to our local community Latinx and Latinx descendants, low and mid-income expectant women population. It basically consists of 10 full prenatal appointments followed by activities that provide patient engagement as well as gestational age-appropriate educational material in the patient's preferred language, English or Spanish, in a stress-free, judgment-free, and unbiased group environment. That is key. Each appointment lasts 2 hours where the patients, after having their own individual prenatal checkups, sit in a circle, like having tea with some friends, with their group providers, preceptors, in-person certified medical interpreter, the coordinator, and some guest speakers from other specialties like dentists, nutritionals, and nutritionists, behavioral health, social work, etc., together with other fellow expectant moms of the same gestational age. We discuss any problems, concerns, myths that the patient might have. Once that all has been covered, then each session has a specific agenda on the material to be covered. And that could include, again, nutrition, lactation, dental, etc. This program also respects confidentiality amongst the groups. So basically, we use an honor system, and all patients understand, sign an agreement, and where they will accept and respect the group's confidentiality. Our personnel also is bilingual, and for those providers and guest speakers or patients that might only speak English, all our lessons, our sessions are basically in English and Spanish. All staff has been trained as facilitators, and we conduct random meetings after each session to evaluate and cover the examples of cultural difference to serve as a learning point for the future. So we're all constantly learning. And on the patient side, what we do is we empower the women to take care of their own health by teaching them how to check their vitals, how to get a better understanding of how their everyday activities, solid and liquid consumptions, environment, etc., can influence, help, or hinder the development of their offspring. Also, by sitting on a circle, we create an environment of equality, which is conducive to provide the patients to become more confident, hence reduces the white coat anxiety by seeing providers as a member of their group. Through open-ended questions and discussions, focused time, clear communication, and by the body language, positive response, attentive attitude and openness of the providers, we provide the patients an opportunity to find their voice and know that their opinion matters, that they are being listened to, cared for, engaged in every aspect of their health. By being on a group setting, we are extending the patient's network of support, information access, and friendship by helping the patients treat these peer-based group appointments as a journey, not as a session, class, or simple appointment. Many of the attendees end up either creating or joining groups with other group members and or graduate moms, the ones that finished the program already, where they can continue having the trusting feeling, the camaraderie, the shared resources they built on our program to help them with the postnatal portion. In summary, Center in Pregnancy provides patients not only with exceptional prenatal care, but most importantly, gives them the knowledge, the confidence, the voice, the relaxing atmosphere in their own community to help them achieve a successful birth and postpartum experience. Thank you so much, and thank you for allowing me to participate in this conference.
Thank you, Roxana. And now we are going to have our sixth giveaway. And this one is a desk giveaway. It is a flip and dodo easel. And for this one, we are going to ask for everyone to comment, and I will take the first person. And what the first person needs to comment is centering program. Centering program. The first person to comment centering program will be the winner. Centering program, centering program. Okay. And centering. Okay. The first person. Okay. And the first person I see here is Ashley O'Rourke. Ashley O'Rourke. I don't know if I pronounce it right. It's Ashlee, last name O''Rourke. And you can stop at our Judge Street office to pick up your prize, Ashley. Thank you so much. And now our next speaker is Chastity with Healthy Mom, Healthy Babies.
Hi, happy Friday, everybody. My name is Chastity, and I'm a nurse with Healthy Moms, Healthy Babies at the City of York Bureau of Health. Healthy Moms, Healthy Babies is a nurse home visitation program where our name is really our mission. And that is that we wish to help women to be healthy or to stay healthy so that their families can be as healthy as they can be. We want everyone to be able to reach their fullest health potential. To be a part of our free voluntary program, you need to live within the city limits, be pregnant, second, third, fifth, seventh time pregnancies are welcome, or parenting a child less than 2 years old. And you can reach us at health@yorkcity.org by email. Our job really is to advocate for you and empower you to reach your full health potential. And as such, you happen to be the most important member of your team. So today I'm going to chat with you for just a few minutes about preeclampsia. And some of you may have heard about preeclampsia, some of you may have experienced preeclampsia, but as the most important member of your team, it's important for you to have the information so that you can advocate for yourself. Preeclampsia is a medical condition that can occur midway through pregnancy, usually about 20 weeks gestational age or beyond. And it actually happens to 1 in every 12 women who are pregnant, which is a pretty significant number of women. Preeclampsia can lead to serious complications like things like preterm deliveries, seizures in the mom, organ damage, long-term medical impacts, and can actually even be life-threatening for mom and baby. So you're going to hear me say a few times today, this phrase, really, really important. So it is really, really important to be receiving your OB care. I'm going to tell you the symptoms of preeclampsia so that you can actually be an advocate for yourself. But most often, preeclampsia is actually detected at a prenatal visit. So one of the most important things you can do is make sure that you're attending your scheduled OB appointments. Again, that's really, really important. And we're not entirely certain why some women get preeclampsia and some women do not, but we do know some risk factors. So we absolutely encourage you to talk to your doctor, talk to your home visitation nurses, and make sure that you're having these conversations about your risk factors so that you can be more aware. This isn't something that we want to be fearful of, but oftentimes when we're aware of things, then we can take better care of our health and prevent complications later on. So for instance, I'll give you a personal example. I've had 3 pregnancies and I had preeclampsia in just one of those pregnancies. And it was not my first pregnancy. So again, we don't completely understand why some women get preeclampsia and some do not. But we want you to be aware of the risk factors and the symptoms, and then kind of what to do as you move forward. So some of the factors that might make you at higher risk for preeclampsia are a history of preeclampsia in you, but actually, interestingly enough, a history of preeclampsia in a family member. So if your sister had preeclampsia, your mom had preeclampsia, that's really important to tell your doctor. If you're pregnant with your first child, first pregnancies tend also to have a higher risk of preeclampsia. So it's really important to get that prenatal care early on. Age can have an impact. So if you're younger than 20 or older than 40, you tend to be at higher risk. People who have medical conditions pre-existing, things like high blood pressure or diabetes, kidney disease, or an autoimmune disease like lupus or rheumatoid arthritis actually make you at higher risk. If you're a person of color, you're also at higher risk. And if you're carrying twins or triplets or more, you're at higher risk of preeclampsia as well. And some people with preeclampsia don't actually ever have really noticeable symptoms, particularly early on, or the symptoms aren't greatly obvious. But some of the symptoms that you might experience that are important to share and connect with your medical provider about include things like severe or constant headaches. This is where it gets tricky because a lot of times in pregnancy, you will have headaches, particularly early on in the pregnancy. But typically with preeclampsia, these headaches are severe, they're constant, they don't go away. You take Tylenol, you lay down, you got rest, and you still have this constant headache. Vision problems. A lot of people will describe having blurred vision or spotty vision where they'll see dark spots. This one is an important one. Pain in your upper right abdomen. So actually underneath your right rib cage, if you have pain there, that is not something to lay down and think that it's going to go away. That's something to call your medical provider about right away. If you are experiencing less urine output, you're not able to pee as easily. When you go to the doctor, they may tell you that you have protein in your urine. That is a sign of preeclampsia. We often tell people that swelling is a sign of preeclampsia, but many women experience swelling, particularly in their feet as they get further along in the pregnancy. But when we're talking about preeclampsia, the most characteristic signs of swelling actually happen to be in the face or in your hands. And usually it's a very quick onset. So it's not like your hands looked a little bit swollen yesterday and a little more today and next week a little bit more. It's usually someone wakes up in the morning and they say, my goodness, my hands, like I can't get my rings off. Or they look at themselves in the mirror and they think, wow, my face looks really round today. Those definitely are symptoms that you would want to talk to your doctor about right away. And another symptom could also be shortness of breath. So those are the symptoms, but what can we do about that? Because that sounds a little bit scary. So what can we do? I said at the beginning, normally preeclampsia is diagnosed at a prenatal appointment. So it's really, really important that we go to our prenatal appointments. And if we need to reschedule, that we get those scheduled right away again. At your prenatal appointments, your doctor, your nurse midwife might ask you to have some labs done or to collect urine for them. Please follow through with that. Again, you're the most important member of your team. And so you being able to follow through with this will help them to have the right answers to care for you. Monitor your blood pressure at home if you've been instructed to do that, or if your home visit nurse is doing that, make sure that you're keeping those appointments with your home visit nurse as well. Your doctor might ask you to take a low dose aspirin, and just noting that you would only do that if your doctor would recommend it. I did want to mention, because this can be confusing, some people call this aspirin baby aspirin, and that is very misleading. Aspirin is never to be used for babies. So it's called baby aspirin because it is a low dose aspirin. It's 81 milligrams. A regular aspirin is 325 milligrams. And so just a notation, if someone says that to you, they don't mean that it should be given to a baby. So your doctor may prescribe a low dose aspirin for you that you would take on a daily basis as a prevention measure. And if they would prescribe something else, like your blood pressure is getting really high with your preeclampsia, and they may prescribe some medication for you to take for the blood pressure, please be sure that you're taking that as it is prescribed. Lots of people start to feel better, and so then they stop taking their medications, and that can be really dangerous as well. Also, just another way of helping to care for yourself, and this really goes along with many other spaces in pregnancy and postpartum, but we want you to take care of yourself in general. So the things like proper rest, proper nutrition, your daily activity, self-care, making sure that you're doing things that help you to relax, taking those medicines as prescribed, and then avoiding things like alcohol, street drugs, and high doses of caffeine are all really important, both before your pregnancy and during your pregnancy particularly. And then I'd really encourage you to trust yourself. Again, I said at the beginning, you are the most important member of your team. And if there is something that you know is just not right, you don't need to wait. You don't need to feel embarrassed. That's the time to reach out to your doctor, reach out to your healthcare professional, and let them know what's going on so that they can give you the best recommendations based on their knowledge and skills. So if you're concerned, trust yourself. Contact your doctor, your nurse midwife. If something doesn't seem right, it is absolutely okay. We want you to be your best advocate. And as a member of your team, our job is to support you in that. So thank you so much for sharing this time with us today. And I'd be happy to answer any questions that you might have. If you want to place those in the chat, we'll have a little bit of time for questions at the end. Thank you so much. Stay well.
Thank you, Chastity. And now we are going to have our seventh giveaway, and it is a sleep basket. In our sleep basket, we have an animal microfreeze blanket, a power bank, 3 board books, breastfeeding bracelets, 24 washcloths, healthy moms, healthy babies, onesies, toothbrushes, toothpaste and floss, safety first tab plug protectors, swaddle me, swaddle, and we have a pack of 2 receiving blankets, hooded towel, and a 6-inch sequin colorful old plushie. And now for our winner, we are going to take the seventh person to comment healthy families. Number 7. Seventh person to comment healthy families will win our 7th basket. Healthy families, okay. 1, 2, okay, 7. 1, 2, 3, 4, 5. Okay, all right. I believe we have 7 comments already. Let me look and see who's the winner today. All right. This is 1, 2, 3, 4, 5, 6. Okay, so for this winner, sorry, let me make sure that I counted right. 1, 2, 3, 4, 5, 6. Okay, it is Kelsey Baker. Kelsey Baker. Kelsie, last name Becker. You are the winner for 7 basket. Stop at our George Street office for your prize. And now our next speaker is Wendy from Perinatal Depression Program. Thank you.
Hi, everybody. Just trying to pull up my slides here. Here we go. Oh, wait, let's do this. There we go. So my name is Wendy, and I am the coordinator of the Perinatal Depression Program at WellSpan. I just wanted to take a few minutes to talk a little bit about perinatal depression in general and some of the things that our program does. It's not letting me advance. Oops. Let's try it from here. There we go. So, some of the truths about postpartum depression, it is the most common post-birth complication. So, not postpartum hemorrhage, not preeclampsia, gestational diabetes, all the other things we hear about, but postpartum depression is the most common post-birth complication. It's one of several conditions that we categorize as postpartum mood disorders. So, that's just a fancy big umbrella type term that covers lots of different disorders. It is any major depressive disorder that occurs in the whole first year postpartum. So, a lot of people think it's going to happen in the first couple weeks or the first couple days. It can actually happen anytime within the first year postpartum. And it occurs in about 10 to 20% of all postpartum women. So, it is more common than you think. And it can happen to anyone. We do know of certain risk factors for postpartum, but it can happen to first-time moms, moms that have already had pregnancies, younger moms, older moms, lots of different factors. Some of the symptoms of postpartum depression would be crying more than usual, feeling angry, feeling like you're losing your temper more often, maybe withdrawing from loved ones, pulling away, wanting to just keep yourself in your room and not be around anyone, feeling numb, feeling disconnected from your baby, feeling you're not bonding right. Maybe being worried that you're going to hurt the baby, feeling guilty about not being a good mom, or doubting your ability to take care of the baby. It's important to remember that this is not considered the baby blues. Baby blues is a normal thing that happens in up to 80% of new moms. Everyone knows hormones are very high for the 9 months that you're pregnant, but they literally crash to zero after delivery. And that kind of puts mom's head into a tailspin and usually comes on very quickly and peaks right around day 3 to 5, which also is when moms are being discharged from the hospital, spending their first night at home, breast milk is coming in. So, a lot of things are going on, and that's when these baby blues tend to hit. Symptoms are mild, usually include a lot of mood swings, crying. Mom might be happy 1 minute, laughing, smiling, just feeling like she couldn't love her baby anymore or be any happier. And the next minute, she's sobbing and she doesn't understand why. This is normal, usually resolves by about 2 weeks. Why do we do universal screening for postpartum mood disorders? Well, because 1 in 8 women report symptoms of depression after giving birth, and about 1 in 5 women were not asked about depression during a prenatal visit. Also, over half of pregnant women with depression were not treated. So it's really important that we screen universally, which means we screen everyone for postpartum depression. Obviously, there's a huge maternal health impact here. Perinatal depression does have long term maternal outcomes. It can affect the likelihood of alcohol or illicit substance abuse. It can also have a negative effect on the infant's cognitive development, learning, and behavior. And it can also affect mom's relationship with her partner, and it might increase the partner's chance of having depression as well. Some of the risk factors, like I said earlier, it can happen to anyone, but we do know certain moms are more at risk. Maybe mom has had a recent stressful life event. She graduated recently. She had a death in the family. She moved to a new home. She quit her job. She started a new job. Moms of lower social support, moms with any previous history of depression or mental health issues. Maybe it was 10 years ago. Maybe it was when mom was a teen. That doesn't really matter. Any history at all of mental health issues puts mom at a greater risk. If mom had problems with infertility or difficulty getting pregnant, she's more at risk. If she's a mom of multiples, twins or triplets, she's more at risk. Being a teen mom, having a preterm delivery, pregnancy and birth complications. We refer to this as like a traumatic delivery. So maybe mom ended up with a stat emergency C section. Maybe she had a postpartum hemorrhage. Maybe she ended up with a baby in NICU that she didn't realize was going to be there. These can be very scary and traumatic and can set mom up for some risk of postpartum depression. So some of the things we screen with are the PHQ-2 and the PHQ-9, and also the EPDS, otherwise called the Edinburgh Postpartum Depression Scale. Just some things to remember about that. We liked the patient to complete the scale on paper herself. We don't want to read it to the patient. It's more validated if she completes it herself. A positive score would be anything greater than or equal to 10, or any thought. The number 10 question refers to thoughts of harm. Thoughts of harm would automatically be a positive screen as well. We always want to remember to use the language that the patient speaks. We have lots of tools in different languages that we can provide if anyone needs them. At WellSpan, we're screening at lots of different times to catch moms at different times where they may be experiencing perinatal depression. We screen at the first prenatal teaching appointment with the nurse, and then again in the third trimester around 28 weeks. We screen immediately postpartum in the hospital, and again at that 4 to 6 week postpartum visit. We can send the mom this screen in her My WellSpan account too. And then we also screen at the 1, 2, 4, and 6 month well child checks at the pediatrician's office. Or if baby is in the NICU, we will screen mom while baby's in the NICU. So our goal here with this multifaceted approach is just that we would be able to catch moms wherever they may be struggling and get them early intervention. Some of the support services that we can offer would be behaviorists. This is a short term therapist. They can see the patient for up to 6 times. The visits are usually 20 to 30-minute visits, and we can do them virtually. It doesn't matter if mom has insurance or what insurance she has. This is a free service. So that one is one that we can quickly schedule moms with, and we use it very often. We also have several different support groups at WellSpan. We have a breastfeeding group, and we have currently Mommy Talk and Toddler Time I have listed here are not meeting due to COVID, but we also have a group called Adjusting to Motherhood. Our breastfeeding group and our Adjusting to Motherhood group meet virtually at this time. They are free groups, and we are happy for any moms in the area to join us with those groups. It's important to validate their feelings and to let them know that they're not alone and be around some other moms that may have similar struggles. We also at WellSpan have several different therapy groups for postpartum depression. And we have what we call OB shared care psychiatry. Probably a lot of you know it's very difficult to get psychiatric appointments right now. And this is a way that we can facilitate moms getting in a little bit more quickly during that OB time. This slide just kind of details how to get help, how to refer to us by email or by phone. Also, Postpartum Support International is a great place for lots of information and resources. They have online support groups and they have a text line that you can call or text as well for more information. So that's all I have for today. I am happy to take questions in the chat later as well. Thank you.
Okay, thank you, Wendy. And now we are going for it giveaway. It is the safety basket. In our safety basket, we have a safety first press tab plug protectors. We have a travel size Crest toothpaste with toothbrushes, floss, and lip balms. Thrive mascara, safety first furniture wall straps, wireless charger and speaker, power bank, pens, water bottle, Curate first aid kit, 3 board books, bottle rack, 2 onesies, and an NFP travel blanket. And for this time, we are going to pick the 8th person that speak. I'm so sorry. The 8th person that comment mental health. 8th person, number 8, and you would comment mental health. Okay. All right. Let's see. And people can. I went twice, so let's see. 1, 2, 3, 4, 5, 6, 7, 8. Let's see. 1, 2, 3, 4, 5, 6, 7, 8. And the 8th person we have here is. Let me make sure. Is 1, 2, 3, 4, 5, 6, 7, 6. Sorry, almost there, guys. The comments are going up. Okay, it will be Paige and Osborne. Paige is the winner for this basket. First name Paige, Paige, last name Osborn. Thank you, Paige. Stop at our Judge Street office for your prize. And now our next speaker is Amanda from Foundation's Pregnancy Support Services. Thank you.
Hi, everyone. My name is Amanda. I am a registered nurse and the program manager for WellSpan's Foundation's Pregnancy Support Services. So I'm excited to present to you today. It's Friday. It was sunny. It still looks like it's sunny. So I'm really excited that you guys are also getting some prizes while you're on here with us. So thank you again. And thank you to Family First Health for having this event for us. So the topic that I'm going to be talking about is pregnancy and substance abuse. With my guest speaker, Beth Hartless, who is one of our community health workers and was a former Foundations client. So the first topic today is pregnancy and substance use. Is substance abuse a concern among pregnant women? So it is actually. 8.4 million women ages 18 plus have abused prescriptions or street drugs over the past year. And the number of women in labor who test positive for opioids has quadrupled since 1999. It is estimated that about 5% of pregnant women, or 1 in 20 pregnant women, will abuse one or more abusive substances while they're pregnant. So while most of the time those substances do include tobacco, alcohol, and cannabis, the most commonly abused substances, opioids, have steadily increased among pregnant women. So abusing substances can be particularly harmful for you and your baby. Some serious causes can come out of this, such as premature labor, which means that you delivered before 37 weeks, miscarriages, where your baby has had a demise before 20 weeks while still in the womb, or a stillbirth where your baby has had a demise outside of the 20 weeks in the womb. A baby exposed to substances that are not monitored or taken as prescriptions can cause significant health problems, such as low birth weight, birth defects, learning difficulties, behavioral problems, and sudden infant death syndrome. Babies may also be exposed to infectious diseases such as HIV, AIDS, or hepatitis C, most of the time because of needle sharing. If you or someone you know has a history of substance abuse, there is help. So next I'll go and talk about the treatment options. So there's inpatient and outpatient treatment options. So what does that look like? So inpatient treatment centers or rehabilitation centers offer an intense inpatient recovery program. Sometimes they're also known as a residential treatment. It requires patients to check themselves into a controlled environment to help them overcome their addiction. The brain reacts differently to different addiction substances over time, and the course and frequency can affect that. So withdrawal symptoms aren't pleasant for any drug, but for some drugs, they should not be done alone or quit without medical supervision. So some withdrawals can be very fatal. A lethal withdrawal is linked to drugs like synthetic opioids, benzodiazepines, alcohol, and heroin. During an inpatient rehab stay, patients have access to 24 hours of medical attention, and this attention is the make or break it between a relapse or a return to use and recovery. It is important to note that opioid detoxing during pregnancy is not recommended because it can result in preterm labor, fetal distress, or a fetal demise. Now, this is coming from the American College of Obstetrics and Gynecology. Comprehensive prenatal treatment for pregnant women with opioid dependency can include prenatal care, chemical dependency counseling, family therapy, nutrition education, and other medical and psychosocial services. So it really is recommended for women that are pregnant who are looking for recovery support to get on a medication-assisted treatment, such as methadone, or buprenorphine. So what does that look like? So there's something that's called an outpatient MAT program. It's a fancy term for medication-assisted treatment, and it is the use of medication in combination with like counseling or like behavioral therapy. It really provides like a whole patient approach to your treatment and your substance use disorder. So medications used in MAT or medication-assisted treatment are approved by the Food and Drug Alcohol Administration and the MAT programs that clinically drive and tailor to meet your needs. Research shows that a combination of medication and therapy can successfully treat these disorders. And for some people struggling with addiction, MAT can also help you to sustain recovery, which is really what you want. So MAT is also used to prevent or reduce opioid overdose. MAT is primarily used for the treatment of addiction to opioids such as heroin and prescription pain relievers such as opiates. The prescription medication operates to normalize the brain chemistry, and it helps to block that euphoric effect that you would get with alcohol or an opioid, and it relieves that psychological craving, and it helps to normalize the body's function without that negative or that euphoric effect that the substance would give you. There's also some things that are helpful in combination with an outpatient, which is called social support. There are 12-step programs like Alcoholics Anonymous or Narcotics Anonymous, which in part goes in hand with an outpatient treatment. Studies have shown that participating in recovery groups like AA or NA really does help with the recovery and helps you to stay sober. So many individuals with a substance use disorder also turn to outpatient treatment as a part of their recovery. So truly the goal of an MAT or medication-assisted treatment is to do a full recovery. That means it's the ability to live a self-directed life. It's a treatment approach that has been shown to improve a patient's survival. It increases your retention in your treatment. It decreases the illicit opiate use and other criminal activities that are sometimes among people with substance use disorders. It increases a patient's ability to gain and maintain employment, and it improves outcomes among women who have substance use disorders and are pregnant. So buprenorphine, methadone, and naltrexone, they are used to treat opioid use disorders. They are short-acting disorders to short-acting opiates such as heroin, morphine, and codeine, as well as the semi-synthetic opioids like oxycodone or hydrocodone. These MAT medications are safe to use for months, years, or sometimes even a lifetime. It really depends on you and your treatment goal. So as with any medication, you do need to consult your doctor, and don't just discontinue something without really talking to your physician or your MAT prescriber. There has been years of research shown that pregnant women depend on opiates who receive MAT have better pregnancy outcomes, which is really what we want, due to more consistent prenatal care, the best nutrition, and less participation in risky behavior commonly associated with substance use. And then there's Narcan or naloxone. It is used to prevent an opioid overdose by reversing the toxic effects of the overdose. So according to the World Health Organization, naloxone is a one-number medication that is considered essential to a functioning healthcare system. You can go to any pharmacy and ask for it through the pharmacy, and you can get a box. It is very life-saving. So if you or anyone that you do know, it would be really important to get that medication and have it on hand. So it talks about breastfeeding while on an MAT. Most women will ask, is this safe? Can I do it? So the transfer of medication for addiction treatment includes methadone, buprenorphine, Subutex or Suboxone, and methadone through breast milk. It is actually very minimal. So that means that breastfeeding while on an MAT is safe for your baby regardless of the dose. Most women will think, if I'm on an MAT and I have a very high dose, let's say 200 milligrams, they will think that it is not safe for their baby, and they'll think that being on 50 milligrams would be better. In actuality, it doesn't matter. The dose does not matter. It is still safe regardless of the amount that you are taking every day. The American Academy of Pediatrics recommends breastfeeding for women, even if you are on the medication-assisted treatment, as long as you are stable on this medication, that you are maintaining your recovery, that you are not using any illicit drugs, and that you do not have an HIV infection. And then it just says that moms should suspend breastfeeding if you do have a return to use of an illicit substance, just because you do want to be careful for the baby. So now we'll talk about neonatal opioid withdrawal symptom. It's also called NOWS. So what is NOWS, and what is the ways to treat NOWS? What does the term neonatal opioid withdrawal symptom mean? NOWS is what happens when your baby is exposed to the drug in a womb before the baby is born. Babies can go through something called withdrawal after birth. The syndrome most often applies to opioid medicines. Hospitals will often use a non-pharmacological method that is approached first, called Eat, Sleep, and Console. This is an evidence-based method that allows the parents to be the primary caregiver. It has other benefits such as mom and baby bonding. It encourages rooming in. It allows for skin-to-skin contact. It allows for you to hold and swaddle your baby. Some other good things to do for the baby after the baby is born is to limit the visitors and allow for that quiet and interrupted sleep time. So again, that is neonatal opioid withdrawal syndrome. And at WellSpan and most other hospitals as well, they do this method with Eat, Sleep, Console, and it has been very proven to decrease the baby's length of stay in the NICU. So it is extremely beneficial. Now, just to talk to you a little bit about Foundations. So what is Foundations? We are a free case management service that provides community resources, collaboration, and connection with healthcare systems, rehabilitation programs, and support to you and your family. So what does that support look like? So we support pregnant and postpartum women who have a current or past history of substance use and their families. So we provide services and support to you and your family during your pregnancy and then 18 months postpartum. You will have a team that consists of a social worker, a health coach, and a community health worker. The team is dedicated to working closely with you and your family based on what your needs are and the desired support that you're looking for. We are here to advocate for you and your family with a goal to keep mom and baby together. We do weekly outreaches that allows us to stay connected with you and provide timely support to you and your baby. So we also do monthly visits that allows us to supply you with baby supplies such as diapers and wipes and clothes. We are very devoted to promoting your recovery and growth by extending our knowledge and how we approach all of our moms with trauma-informed care. And we are actually currently working with other WellSpan programs to see what kind of housing options we could do in support for our moms and the families. And we were actually just awarded yesterday a grant that will allow us to do what's called interactive journaling, which we will do with moms in support groups. And that is an evidence-based program as well. So we're very excited for these things. I'd like to go ahead and introduce you to Beth, who again is our community health worker and a mom that used to be in our foundations program.
Hi, good afternoon, ladies and gentlemen. My name is Beth, and I'm the community found a totally different life called recovery. Soon after I began my life in my recovery, I mustered up the courage to explain to all my health care team that I battled with the
All right, this program is designed to help mothers achieve their goals that they may have. Our patients could be one step away from a different life, and our support will help them have amazing progress. And progress is true happiness. And we validate that they're worthy of a great life. And we are here to make real change in our patients' lives. And I know this works because I'm sitting here today. Thank you for your time.
All right, thank you, Beth. And now we are going to have our ninth and last giveaway for today. And for our last giveaway, it is a self-care basket. And in our self-care basket, we have a Shivam bracelet and Beauty Concept lip gloss set, Wellspin bag and stress ball, box of Stroop waffles, English breakfast tea, 2 large bath puffs, and we have a lot of stuff. So, and we also have some nail polish, shower cap, cosmetic bag, uh, magnetic list pads, and we also have other self-care candles. And now for our winner, we are going to take the third person to comment recovery. Third person to comment recovery. The third person to comment recovery. Okay, we have a winner, and let's see who it is. Give me 1 second because all of the comments are popping up now. 1, 2, 3. The third person is Cassandra Arias. KASSANDRAARIAS. And Cassandra is the third person to comment recovery. Thank you, Cassandra. And remember, everyone who wins our giveaway today, remember all giveaways must be picked up at Family First Health, George Street at the third floor receptionist between Monday and Friday from 9 a.m. and 3 p.m. Thank you. And here's Lisa Lathrop with our closing.
This brings our presentation for Maternal Child Health Awareness Month to a close. Thank you so much to all of our presenters who work hard every day to provide valuable programs and services to a population that is so important to this community that we love. A very special thank you to Nicole Cooper of Nurse Family Partnership, who worked very hard, often behind the scenes, to pull this presentation together. And also a thank you to Amy Chamberlain, who's also behind the scenes. I also want to thank everyone who participated by viewing this presentation, and I hope that you learned something that you can take away from today that will help you and your family. Again, if you want a prize, please make sure you pick it up on the third floor of Family First Health, 116 South George Street. Have a wonderful weekend, and know that the maternal child health community is here for you, and we are happy to serve you in whatever way we can. Thank you, everyone.